What is conversion disorder? Defined by Medline Plus, conversion disorder is a mental condition in which a person has blindness, paralysis, or other neurological symptoms that cannot be explained by a medical evaluation.
In our case study, Rosalind is an 18-year-old girl who experiences stuttering and has a hard time speaking after her class is discussing sexual harassment and sexual molestation in a women's issues seminar. When she goes to the student health service, the interviewer asks her if she has ever been approached in a sexual way as a child. She explains when she was a child, she had a male family friend who had sexually abused her, and when she told her mother, she had told her not to say anything to avoid confrontation from her father and the man. She has been struggling with this ever since. What she is experiencing is a classic conversion disorder symptom, which is the result of her traumatic sexual abuse as a young girl.
Let's talk about the signs and symptoms of conversion disorder. Now, some of the signs and symptoms that would affect the body movement and function would be weakness or paralysis, abnormal movement such as tremors or problems walking, loss of balance, difficulty swallowing or feeling a lump in the throat, seizures or episodes of shaking, and apparent loss of consciousness. These would be non-epileptic seizures and episodes of unresponsiveness. Now, some signs and symptoms that would affect the senses would be numbness or loss of touch sensation, speech problems such as the inability to speak or slurred speech, vision problems such as double vision or blindness, hearing problems or deafness, cognitive difficulties involving memory and concentration. So what are the causes of conversion disorder? Conversion disorder may occur because of a psychological conflict. Symptoms usually begin suddenly after a stressful or traumatic experience. So this disorder is believed to be associated with psychological stressors. Pierre Janet had emphasized the relation between conversion disorder and childhood trauma by the end of the 19th century. He viewed this disassociation of cognitive, sensory, and motor processes, which are signs and symptoms of conversion disorder, as an adaptive process for dealing with these traumatic events that an individual with conversion disorder had experienced. People with conversion disorder may also have underlying medical illnesses and other underlying dissociative disorders as well.
Some factors that might increase your risk in having conversion disorder are having a neurological disease or disorder such as epilepsy, migraines, or a movement disorder, recent significant stress or emotional or physical trauma, also having a mental health condition such as mood or anxiety disorder, dissociative disorder, or other certain personality disorders. Also having a family member with neurological conditions or symptoms, and also having a history of physical or sexual abuse or neglect as a child. Conversion disorder can cause many complications in a person's life. If symptoms are not treated, it can result in substantial disability and poor quality of life, similar to problems that are caused by medical conditions or even disease. These complications can include pain, anxiety disorders, including panic disorder, depression, insomnia, and also fatigue. In terms of functionability with having conversion disorder, it can be very hard to cope with these symptoms. People who may need to do something as easy as going to the grocery store or doing things around the house, if they are having trouble walking or even experiencing blindness, this would be a challenge for them, and they may need someone to come in and assist them. People who do not treat their conversion disorder symptoms early on, they may experience a long duration of debilitation, and this usually results in them having to stop working. If symptoms are treated early on, they can recover and resume life as normal. Many symptoms of conversion disorder typically don't last very long. Some are up to about a few weeks, but then it does typically get better afterwards and doesn't usually happen after that for a while.
What are the treatment options for conversion disorder? Physical, occupational, or speech therapy can help the affected body parts or the impaired physical function. Hypnosis and psychodynamic approaches could also potentially be beneficial, but do require a more vigorous study. Medications are definitely the most used treatment option as they assist in treating the medical condition that may coexist in a patient affected with conversion disorder. Talking with a therapist about stress management and techniques to cope with somebody's stress may also reduce their symptoms. Advice for patient, family, and friends. It's important to believe that the patient is telling the truth and not accuse them of faking their symptoms, as well as reassuring them that you understand their symptoms are real and that you're committed to helping them get evaluated and treated for their conditions. Talk to a primary care provider to get more education on how you can help the patient. A few services that we offer here in Manitoba include Strength Counseling, a service by counselor Amanda Dewar. It is located in both Brandon as well as Portage la Prairie. The sessions with Amanda cost from $25 to $150 depending on the length of your session. Strength counseling offers a holistic approach to healing, focusing on mental, emotional, spiritual, as well as physical well-being. The next available service is called Manitoba Virtual Therapy Program, and it began at the beginning of the COVID-19 pandemic. For this program, you do not need to be referred to by a doctor, but you will be connected to a healthcare professional who are trained in helping with stress management. The Canadian Mental Health Association is another great source. It is one of the most established and most extensive community mental health organizations that we have access to here in Canada. They offer access to programs that support mental health as well as mental illness, and they also provide knowledge for family and friends. Another great resource is the Anxiety Disorder Association of Manitoba. They provide support groups for prevention education or early interventions in children, adolescents, adults, and as well as their family members. A local mental health resource that we have here that is ran through Prairie Mountain Health is called Westman Crisis Service. This can be accessed by phone 24 hours a day for any adult over the age of 18.